I started having the lower back pain on my left side in early 2022, and Dr. Ju tried different procedures from nerve ablations and we finally ended up with steroid injections because that was the most helpful for a short period of time. And then in November of 23, it was so bad. I said, we've got to find something else. And so he went this route. He made that decision, and it was certainly the right decision, because now I can tie my shoes. I can do things around the house that I couldn't do before, and I wouldn't be able to do that if we hadn't gone this route.
Well, I've been an interventional pain specialist for now 25 years. My goal has always been to be on the forefront of new technologies, because I realized that when I started in pain, we just had injections and ablations, but I really wanted to bring the field to the next level. And when you start looking at new innovations, SI joint fusion was one of those that I immediately gravitated to, but I saw the results. It works. And when I started putting in Liberty, I just couldn't imagine that just one screw technique worked that well, but it has been everything that has been advertised. So I've been seeing Miss Hoover since about 2009, and she's had various different pain symptoms and syndromes during the time. She's undergone a couple of different back surgeries, and I've helped support her during those times. And as we've found out with back surgery, she started developing SI joint pain. We started out doing injections, did some radio frequency. When it didn't seem to give her much long-lasting relief, started talking to her about SI joint fusion. And probably about a year ago, we came to the conclusion that we would put in a Liberty device with a single lateral screw. She has done exemplary, both in the post-op setting and functionality. She's now able to do things that she couldn't do for at least a year or two.